angioplasty or possible stent placement. Lower extremity. Introduction. Sometimes people have serious problems with their legs and the blood vessels that go into them. A lower extremity angiogram is a test that helps your doctors look at the blood vessels of the legs. If your doctor recommends a lower extremity angiogram and possible angioplasty, the decision whether or not to have the procedures is also yours. This program will help you understand better the benefits and risks of this procedure. The blood vessels of the legs originate in the pelvis and go all the way down to the feet. The iliac arteries branch off from the aorta in the pelvis. The iliac arteries divide into different blood vessels. One of them is the femoral artery that goes into the leg. In the lower thigh, the femoral artery branches to the popliteal artery that takes blood all the way to the foot. Symptoms and their causes. Atherosclerotic vascular disease, or hardening of the arteries, causes deposits that accumulate in the leg blood vessels or their branches and can cause blood flow to decrease. This is the cross-section of a normal blood vessel, and this is the cross-section of a blood vessel clogged with these deposits. This decrease in blood flow can cause severe leg pain. It could even cause the tissue in the leg and foot to die. Blood vessel abnormalities called aneurysms can form. A lower extremity angiogram helps show the leg blood vessels and detect any abnormalities. Procedure. The angiogram is usually done on an outpatient basis, meaning you will be able to go home after the test is completed. You cannot drive after the procedure. Arrange for somebody to drive you home. After an IV is placed, you are taken to the procedure area. This procedure is done while you are sedated. There is very little pain involved. You are asked to lie down on the X-ray table. During the procedure, your heart rate, blood pressure, and respiratory rate are continuously monitored. You will receive small doses of medications for pain and to help you relax through your IV. The groin area is then disinfected and numbed with local anesthesia. A long tube called a catheter is then inserted through the skin into an artery in the leg and threaded into the leg blood vessels. Sometimes, depending on the physician's preference and the state of your arteries, the catheter may be placed in a big artery in the underarm or upper arm. Contrast is then injected into the arteries and X-rays are taken. When the contrast is injected, you may feel some warmth in the leg or other parts of the body. You should stay very still when the X-rays are taken to allow good, sharp pictures. If a blockage is found, the doctor will decide whether it can be opened using either a balloon or another device. The procedure that uses a balloon is called angioplasty. The balloon is attached to the end of the catheter and is threaded up to the area of the blockage through the artery used for the angiogram. The balloon is then inflated to break up the plaque, which widens the artery, allowing more blood to flow through. The balloon is then deflated and withdrawn. Following the angioplasty, your doctor may choose to place a stent, a special hollow tube at the site of the blockage to keep it open. If a stent is used, it is attached at the end of the catheter and placed at the site. A stent may also be used without a balloon to open a blocked artery. Another way to open blocked arteries without angioplasty is a small mechanical device that breaks the plaque into pieces. The doctor makes this decision at that time. In addition to breaking up the plaque, A stent could be placed. You may receive a blood-thinning agent if the artery is fixed. After the angiogram and the angioplasty, if it is needed, the catheter is taken out and pressure is applied on the injection site to ensure that there is no bleeding. Alternatively, a special plug or suture is used to close the little hole in the artery. You may need to stay flat and for 6 to 8 hours not move the leg on the side that was catheterized. If the artery is repaired, you may be asked to spend the night in the hospital. Risks and complications. This procedure is very safe. There are, however, several possible risks and complications. These are very unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. X-rays are used during this procedure. The amount of radiation used during this test is deemed safe. However, the same amount could be dangerous for unborn children. It is therefore very important to make sure you're not pregnant prior to an elective radiological test. Infection at the injection site is rare. The catheter placed in the artery can rarely injure the blood vessels of the body. The insertion can also cause injury to a nerve in the leg or arm depending on where the initial injection was done. Some people have allergies to the iodine contrast or to other drugs, like the numbing medicine used in this test. Make sure to tell your doctor about your allergies and about any possible reactions to any sort of contrast used on you in the past. Make sure to mention if you are diabetic and on glucophage, also known as metformin. In some people, the contrast can cause kidney failure, especially if you already have kidney problems. You will be advised of things to do and precautions will be taken to minimize the risk. Make sure to contact your doctor in case of any new symptoms, such as infection, fever or weakness, swelling, or bleeding at the injection site. The angioplasty may not succeed in relieving the blockage. Even if relieved, the blockage could happen again. This could lead to further blockage of the artery. Summary. People can have several kinds of problems, like blockages in the arteries in their legs. Some of these arteries are called the femoral and popliteal arteries. Angiograms may be very helpful in detecting blockages in the leg. If a lower extremity artery is blocked, a lower extremity angioplasty is a procedure that allows your doctor to open narrowed arteries of the leg. This procedure uses a balloon to open arteries so that blood flow to the legs can be increased. A stent may be placed to keep the artery open. Angiograms are very safe. Risks are low and complications are very rare. Knowing about them will help you detect them early if they happen. Thank you for using Explain.